Hi everyone, welcome to Medicare 101 brought to you by Good Shepherd Healthcare System. Today's presentation is presented by Karina Herrera, Senior Services Coordinator with Good Shepherd Healthcare System. Facilitating today's class is Jessica Reeker, Community Health Educator with Good Shepherd. If you have any questions after viewing today's class, please feel free to contact the Education Department at 541-667-3509. Thank you and enjoy.
So here's a Medicare 101, and this is for Oregon. Each state has their own special regulations and rules. So this is the rules for Oregon. California's SHIBA organization is called HICAPS, and each state has their own, but it is a contract with Medicare. And so what we do is we cancel people on Medicare. Here's a couple of, or the acronyms that we use regularly, and it's CMS for Senior or Centers for Medicare and Medicaid Services, IEP, Initial Enrollment Period, OEP and AEP is Open or Annual Enrollment Period, GEP is General Enrollment Period, SEP is Special Enrollment Period, MAPD is Medicare Advantage or Medicare Advantage with the prescription plan, PDP is a prescription drug plan, and DME is durable medical equipment. Some other acronyms that are not on here that we will discuss also in this slideshow is QMB, SMB, and SMF, and those all have to do with extra help or Medicare savings program. SHIBA stands for Senior Health Insurance Assistance. It's a program through Medicare or grant funded, so it's a free service for anybody that is needing help with Medicare or their family members to help guide their grandparents or parents through Medicare. We provide information about Medicare, how it runs, the laws, the regulations. We help analyze the plans for you to make sure you have the plan that you need. We connect clients to computer-based information and resources, or we teach the family members on how to access those computer-based information. And we process enrollments. We also help guide people through the Social Security process, and we do counseling on how to do the Social Security computer-based process also. We inform everybody about Medicare A and B and Advantage plans. Our main source of information is this book that is pretty much our Bible. Everything that you would ever need about Oregon Medicare is in here, and if anybody wants a book or two, we can mail it out to you. Just let us know. Here's our SHIBA website. It's www.medicarestartsaT65. On this website, you could get an electronic version of this book and much other information that you could ever need. And if you know someone that would like to volunteer, because all our certified counselors are volunteers, you could click on this button here and it'll guide you through the process on learning how to volunteer for this to become a SHIBA counselor. So frequently asked questions. I'm still working. Do I need to enroll in Medicare? And of course, it depends. It depends on if your employer health insurance is comparable to what Medicare covers. So that is covers 80% of all your healthcare costs, and your prescription plan is less, deductible is less than $435 for this year. Then you could enroll in Medicare Part A, which is no cost to you, and Medicare Part B, you don't have to worry about. So it depends on your coverage that you already have if you're still working. And if you have to be active working employee to be able to not have to pay for Medicare Part B. If you earned credits for your health care, but you retired months ago, then that does not count, and you could be penalized if you don't have sign up for Part B within 10 months. Here's what the old Medicare card looks like. And Medicare is for people that are 65 years or older, or people under 65 that have been on disability for 25 months or longer. And Social Security is the only people that can enroll you into Medicare. If you are receiving your Social Security payments before you turn 65, it would automatically sign you up for Medicare once you're 65. But if you're not receiving your Social Security payments, then you have to call Social Security or create a Social Security account and sign up for Medicare yourself. Okay, and this is what the new card looks like. It's a little different, as you can see, where the number, your Social Security number used to be, it's now a random numbers. And everything else is pretty much the same. Still blue, white, and red, and still has Part A and B. Your Medicare card will never, ever show that you have Part C or D. That is through private insurances, and that's up to you to take care of. There's 4 different parts to Medicare. Medicare Part A is hospital insurance only. It's inpatient hospital insurance. Medicare Part B is everything else that's not inpatient hospital services. Medicare Part C is Medicare Advantage plans, which you have to have A and B to be able to sign up for C. And Medicare Part D is prescription drug plan, which Medicare Part B and Medicare Part D, you could be penalized for if you don't have comparable insurance. So Medicare option 1 is only having Part A and B and D, because D you have to have or you're penalized for. And I'll go into the penalty later. And if you have A and B, you can have a secondary insurance, which is Medigap or Advantage plans. Advantage plan is, I will go into that later, so I don't repeat myself. So Medicare Advantage plan is your prescription plan, and it covers some or all of the funds that Medicare Part A and B do not cover. Medicare Part B covers 80% of all your healthcare costs, and Medicare Part A covers your hospitalization minus $1,406 deductible each time you're in the hospital for 5 days or longer. So, and it goes into this. The premium for Medicare, as long as you have worked the 40 credits work hours, then Medicare Part A is not free, but no longer is charged to you because you paid into it, paying taxes. But if you don't have the 40 credits of work history, then you would pay $458 a month. Your deductible is $408 for the first 60 days of inpatient hospitalization. So if you go into the hospital January 1st and you're discharged January 6th, you pay that $1,408. You're discharged for 60 days, and then you go back in April 1st and you're discharged April 6th, you pay that $1,408 again. So each time you're discharged for 60 days or longer, then you have to pay that deductible. So it's not a one-time-a-year deductible. And Medicare Part A only covers your hospitalization for the first 60 days, and after that, it is up to you to cover the rest of the cost. Medicare Part A covers room and board, general nursing, supplies, and medications. And it also covers skilled nursing facility for 60 days for no copay. It will only cover that if you're inpatient for 3 nights or longer. If you're in the skilled nursing facility for days 21 to 100, then it costs $176 a day. Medicare Part A also covers home health. And this is how you know that you're in the hospital as a inpatient. If you sign this form, it says Medicare outpatient observation notice. It will tell you you are not an inpatient. So if you sign this, then you don't automatically receive the skilled nursing facility for 20 days. You would have to pay out of pocket for those. Medicare Part B insurance is optional if you have comparable insurance or you want to pay a penalty. The premium is $144.60 a month for 2020. And this income base is if you make more than $750,000 a year, then you have to pay more for your premium. So if you make $750,000 to $1 million for a couple, then your premiums would probably be closer to $300-400. There's a $198 annual deductible. Medicare Part B covers 20% of all the health care costs. It covers outpatient surgeries, like doctor's visits, emergency room, ambulance, observation stays in the hospital, medical, durable medical equipment, lab tests, PT, and outpatient surgeries. And Medicare covers preventative services at 100%. What's not covered by Medicare is annual physical exams, but you could change the wording on that to ask your doctor for a wellness check, and then it's covered at 100%. But if you call your doctor and you say you want a physical, it will not be covered. Routine vision, except for diabetes or cataracts, because that's a health condition and not just a regular vision exam. Dental care, hearing aids, long-term care are insurances that are not covered under Medicare. Does anyone have any questions? Oh, the little pup point.
I think can you hear me?
Yes.
I think I would have questions. Sorry, I was having trouble getting logged on, but with the deductibles, can you go over the deductibles again? It's for the Part A, it's $1,408, and that's for the first 60 days. And once that is met, then it's on the client to pay the rest.
There's a one-time deductible of $1,408. Not a one-time. That was not correct. If you go in the hospital for 5 days or more, then it's $1,408. If you're discharged out of the hospital and you go back in after 60 days of the date of discharge, then you pay that deductible again. But if you go back into the hospital before 60 days, you won't have to pay that because it's covered for the 60 days. I
see. And then so for the Part B, is that, I'm sorry, I guess I just fully missed that part, but there's a $198 annual deductibles, what I think I saw. There it is. Now, how does that work? Are they being charged the premium of $144.60, and aside from that, it's a $198 that everybody across the board pays?
Yes. Yes, so it's pretty much your first doctor's visit of the year. You'll have to pay for in full, and then Medicare Part B will cover 80%, and you would be responsible for 20% of the healthcare costs after you pay your deductible.
Okay. Okay, thank you.
Thank you. Anybody else have any questions? Okay, so now this is a supplemental insurance. So there's two supplemental insurances that you could buy to cover that $1,408 deductible for Medicare Part A, to cover the 20% for Medicare Part B that they don't cover. And one is called a Medigap plan. The secondary is supplemental insurance. It's sold by private insurance companies, but they are contracted with Medicare. So if Medicare approves these insurance companies, then it's okay to purchase with them. And the Medigap plan pays after Medicare pays their coverage. And so this year they did a little switch up, and I'll explain that later on about the F plan and the C plan. Because the F and C plan, you don't pay the deductibles, but those are no longer being offered to people that are born after January 1st of 2020, or not born, but turned 65 after January 1st, 2020. The F and C plans are no longer available to them, but if you were on Medicare for 10 years, you could still switch your F and C plan. There are 9 plans. A lot of people get these confused because these are plans. And when you're talking about Medicare, those are parts. So Medicare have parts A, B, C, and D. Now Medigap has plans A through N minus a whole bunch, C, E, F, H, I, and J. They had eliminated all these plans over the last several years. The F plan is available to people that turn 65 before January 1st, 2020. Cost varies depending on what plan you have. If you want more coverage, of course, you're going to have to pay more for these premiums. And these premiums are on top of the Medicare Part B, $144.60. So the average person pays, new to Medicare, the average person pays about $300 for good insurance to be covered well. And the cost for these Medigap plans depends on company, county, and what plan you choose. So with the Medigap plan, you could sign up anytime you want. Any day of the year, there's not a restriction, but if you sign up for this plan outside of the guarantee issue period, which we'll go over that, they could deny you, and then you would have no insurance. And the guarantee issue period is the 6 months of open enrollment period, which is once you sign up for Medicare Part B and 6 months after. They cannot deny you on that. If you lose your health insurance coverage, if you're over 65 and you lose your health insurance coverage, say through your employer, you have 63 days to sign up for a Medigap plan, and they can't deny you. Or this is specific for Oregon only. The day of your birth or 30 days after, you could change your Medigap plan with the guarantee issue, and they cannot deny you. So employee coverage insurance. So EGHP, Employee Group Health Plan of employees of 20 employees or less and 100 employees if Medicare is due to disability is comparable to Medicare. Retirement coverage such as TRICARE and Campus VA and Medicaid or other insurances that work with Medicare. Medicare savings plan. So here's where it gets a little iffy. So Medicare savings plan is not like a Medicaid. It's what it is a savings plan. It just saves you money. So it has the financial assistance with the cost of Medicare. People that make less than $1,456 single or $1,960 as a couple, they will save money by not having to pay for your Medicare Part B. So that's the $166 or $144.60. You don't have to pay the premiums up to $33 for your prescription plan. You don't have to pay your prescription deductible, and your copays for your prescriptions is less. So it's less money coming out of pocket for the person that's on Medicare. Medicare Part D prescription insurance is optional, but you will be penalized if you don't have it. You must be enrolled in Medicare Part A or Part B or both. Insurance is through a private company, also contracted with Medicare. Premiums vary depending on the plan. Covers self-administered medication. So what that means is if you have to have if you have a diabetic pump and you have to put insulin into that pump to put it into your body, that is not self-administered. It was a device that put it into your body, so that would be covered under Medicare Part B, such as needles for insulin, or nebulizers, or albuterol for nebulizers. Those are all covered under Part B, since you have to have a device to put it into your body. Okay, so we're going to find out what is the best plan for everyone. So the easiest way to do this is to go to medicare.gov, and you click on where that red arrow is, either log in or create an account. You create an account by these simple information. It's just, and there's one more section that was cut off at the bottom. Oh, no, it wasn't. It's right there, your zip code. So all you need is your Medicare number, last name. You don't have to put the email address. You could put, I don't have an email address, your date of birth and your zip code, and when Medicare Part A started, and then you have the ability to create an account. Once you get past that first step and you haven't already created an account, you would go to this page, you create your username, password, and do your security question, and then push submit. It'll throw you back into this page, and then you put in your username and password, and then you would click. So here on this screen, you could do a lot of things. You could pay your premium if you don't have it automatically taken out of your Social Security check. You could pay your Part B premium. You could print your Medicare card, or you could print a list of your medications that you put in to the system. But we're going to go to plans and coverage where the red arrow is. And from here, so I don't have so many slides, you on the next screen, you would click Find and Compare 2020 plans, and then click on what you're looking for, if it's a Advantage plan, a drug plan, or a Medigap plan. Select the county that you live in. There'll always be an option. Select Yes to see your drug cost. Select what pharmacy. When you put in your zip code at the first page, it'll bring up all the pharmacies that are within 50 miles of that zip code. So you just pick what pharmacy you would like to use, and you could choose up to 3 to compare. And then you would put in your prescriptions. In this program, it doesn't count over the counter. So if you use an aspirin, even though it's prescribed, it won't count. So it's just the prescriptions that you cannot get over the counter. And you could, you choose what pharmacy you want. The pharmacy does make a difference, because from each pharmacy to each pharmacy, they charge their own price. And some pharmacies could be out of network, some pharmacies could be in network, and you could save hundreds, if not thousands of dollars a year. And then once you're in there, you, under the sort plans by, you want to choose, of course, the lowest drug and premium cost. And then you can review your plan information. And then if you want to pick that plan, you enroll, and then you answer the questions that are asked, which is simple address and stuff like that. Now, when you go into view plan, and this is what I'll tell you about the different pharmacies. So I just put in 2 kind of expensive medications, and the cost for the year will be here, and that is your plan premium and your copay cost. So by the red arrow, it will be for these 2 medications for the year, it would cost this person $1,282.05 at Hermiston Drug. And down below, it'll say it'll start in June, because we're in May, that this person will have to pay $84. So if you look down in October, it goes up. So that means this person has entered the coverage gap. The donut hole is what everybody says it is. And so this tells you month by month, so people know how much they have to save for if they go into the coverage gap. Now here's Safeway's plan, which is $1,192 for the same exact medication. So Hermiston Drug and Safeway, you'll save about $100. And here you don't go into the coverage gap until $224 or $224 in November. Murray's drugs is $1,332, so it's $100 more than the first pharmacy. So it greatly depends on what pharmacy you choose to pick up your medications from on how much money you could save. Make sure you always do the preferred pharmacy. I'll go back and under where it says Murray's Boardman, it says standard in-network policies. So that's not a preferred, but Safeway is the preferred pharmacy. Hermiston Drug is a preferred pharmacy. You could do mail order, which will save you some money because you only have to pay one copay for 3 months instead of a copay every month for 3 months. But they must be contracted pharmacies. So if you go through here and you pick whatever prescription plan through Medicare.gov, they're always contracted. So financial assistance with extra help, low income is also called extra help. Eligibility, the maximum income for a single person is $1,615. For a couple is $2,175. On this one, resources are counted. On the savings plan, resources are not counted. So you can't have more resources besides one car in the house that you live in that costs more than $14,610 for a single person, or $29,160 for a couple. And what this will do, it will pay the prescription premium up to $33.80 a month. So if you pick a prescription plan that costs $50, you would have to pay the remaining, but they'll cover up to the $33. It reduced copays at the pharmacy 15% of cost or less, and you could apply for it by the Oregon Medicare Savings Connect at this number, or you could call us and we could apply for you. And here's the guideline sheet. It's called a fact sheet. So there's 4 different levels. Levels 1 is, I told you before, QMB, SMB, SMF, and there's the income limits on the second column. For qualifying for that, the only difference between all 3 of these is QMB. The state will be the secondary insurance for those individuals. It's not Medicaid, it's through the state. Now, if they're dual, level 2 or 3, then they're on Medicaid and Medicare. And level 4 is, I talked about in the last slide, it just pays some of your medication premium and your deductible and up to 15% of your copays. And this changes every year. Now, Medicare Advantage plans. You must have A and B in order to get an Advantage plan. An Advantage plan is per your area. So per county here, in it's Umatilla and Morrow County that have one Advantage plan. And the premiums vary depending on the Advantage plan. And these are privately managed Medicare. So with Advantage plans, Advantage plan is billed first, and then they send the rest of the bill to Medicare. With Advantage plan, it has prescription coverage with it. You can, the one Advantage plan that we have in this area does have dental and vision. And the Advantage plan has to take everybody no matter what, unless they're end-stage renal disease. And they could choose how much copay you pay to go see the doctor and how much you have to pay for services. So the one Advantage plan that we have in this area is not an HMO. So I'm not going to go into that. But if you move to a different area or a different county, you can have an HMO Advantage plan. They're usually cheaper, but you pay more out of pocket. The one we do have is a PPO. It has better coverage. It has more coverage. It is more expensive. The Advantage plan that we have in this area is the PPO that costs $139 a month. So that would be $139 plus your $144. And always check to make sure your provider accepts it. So how do you enroll in Medicare? You're automatically enrolled if you're already receiving Social Security or railroad retirement benefits. If not, you have to enroll within the 7-month initial enrollment period, which I'll show you a slide. I think it's next. You contact Social Security. You make sure you document, you get the person's name that you talked to, the time of day you talked to them, the day that you talked to them, and what you discussed. In the past, I haven't heard about anything recently, but in the past, there's been having problems with confusion between Social Security and Medicare recipients. Or you could call that number, or you could create an account with Social Security at www.ssa.gov, or you could call us, and I could give you the direct number to the Pendleton office. And if you're receiving Social Security disability, your Medicare will automatically begin on the 25th month of your cash payments. Here's the 7-month initial enrollment period. You have 3 months before the month of your birth, the month of your birth, and 3 months after the month of your birth. So if you sign up for 3 months before the month of your birth, it will start the month of your birth. If you sign up the month of your birth, then it will start the month after the month of your birth. After the month, 2 months after the month of your birth, it just delays it 2 and 3 more months. But those are the 7-month enrollment period without being penalized. So it's always good to start working on your Medicare, getting signed up, because it does take 6 to 8 weeks to get your Medicare card. And as I showed you in the previous slide, you need that Medicare number in order to get a drug plan, in order to get a Medigap plan, a Advantage plan. You need that number. So it's always recommended that you start 3 months before the month of your birth. If you're still working, you have to have active work. You can't have a credit for your work and still have the insurance or pay for your insurance out of pocket after you ended your employment. And COBRA does not count. You have 8 months by the time that your employee group health plan ends to sign up for Medicare without a penalty. If you miss signing up for Medicare Part A and or B during initial enrollment period, you can enroll Medicare during general enrollment period, which is January 1st through March 31st of each year. It won't go in effect until July 1st. Late enrollment penalties for Part B and Part D may apply. When can people join Medicare Advantage plan or prescription drug plan? So these are different than your Medigap plans that you can join at any time. These you could join when you're first eligible for Medicare, or 3 months before, during specific enrollment periods, such as annual enrollment period, which is October 15th to December 7th every year, and your changes won't go into effect till January 1st. General enrollment period, which is April 1st to June 30th, and it won't go into effect until July 1st. And special enrollment periods, such as if you move to a new area or your previous plan cancels in the middle of the year. Special enrollment period, you could sign up for a new one within 60 days. Late enrollment is determined by Social Security. For Medicare Part A, it's 10% of the current premium for twice as long as the delay. So if you're delayed enrolling into A for 10 years, you'll have to pay that penalty for 20 years. For Medicare Part B, it's 10% of the current premium for each 12-month Medicare eligible period for as long as you have the Medicare. So Part B, you're penalized for the rest of your life. Part D is determined by the prescription drug plan. It's 1% of the national base premium. So it's 1% of whatever that prescription drug plan is billing for each month. And that is for the rest of your life also, with a max of $32.74 for 2020. Okay, PERS, Public Employee Retirement System, must be eligible for PERS pension, and the eligibility is determined by PERS. Must have Medicare's Part A and B, must enroll within 90 days of Medicare eligibility, and is, if you're working past 65, must have continuous health insurance without the insurance gap. Here's the PERS contact information. I'll leave it here for a second or two. Does anybody else have any more questions?
I have questions. I guess I'm going back to the extra help. So did you say with the extra help that you would help get them like enrolled, or is this something that happens automatically through Social Security? How does that happen for a client if they are not? For example, today I had a client. He seemed to be eligible for extra help, but he did not have extra help. How does that happen?
I don't know how that happens, but I received a letter earlier this year that there are over 3,000 people in Umatilla-Morrow County that qualify for extra help that are not receiving the extra help. Usually when I do my counseling with all my Medicare people, I always ask their income to make sure that they're receiving all the services that they should be receiving. Most of the time, the extra help, most of the time with Medicaid, it gets transferred over once they turn 65. Most of the time it gets transferred over to QMB, which is not Medicaid, but similar to Medicaid. But if they have SMB or SMF, then it doesn't transfer over and they have to reapply for it. And it's a simple question. It's about 30 questions. That's including their name and their address. And we could do it here in the office.
And as far as eligibility requirements for the couple, $2,175, or even for single, if they are employed, does that calculation, do you know if it is a calculation that counts all of the employment income, or is it like the Medicare Savings Program that would cover, would be calculated about half of their income?
No, it covers all. You have to report all the income if they're working or not.
And it's the first time I hear. Sorry, go ahead.
It covers like IRAs too. If you get monthly payments from the IRAs, you have to put that in there too.
And it's the first time I hear about Part D penalty. So it's optional, yet there is a penalty. So the longer you wait, the more it'll cost you to have a Part D plan. Again, across the board.
Yes.
Okay.
It's optional, and it's your option to pay that penalty or not.
Okay, thank you.
I don't like how they use that word optional, because you're forced to either pay a penalty or pay for your prescription plan. So that word optional shouldn't have been in the book, but that's how they wrote it.
Okay.
Does anybody else have any questions? Okay. So moving on to federal employee health plans. Federal retirees are not required to enroll into Medicare because they have their insurance through like the VA, and also tribal do not need to enroll into Medicare, but it's idea to help save the tribe money with the healthcare costs, because even though they're tribal, they could still bill Medicare for treating the person, even though they won't bill the person. Health insurance options are coordinated with Medicare if enrolled, and you could suspend your federal employee health benefits to enroll into a Medicare Advantage plan if a retiree has Medicare Part A and B. Prescription drug coverage is credible to Medicare. Open season, I'm pretty sure is November 13th to December 11th throughout every year. And I know a lot of my clients that have the federal employee health benefits, they do sign up for Medicare Part A because that's no payment for them. Most of them work outside of working for the government. And so the A, it has no fees, and they'll sign up for a prescription drug plan so they don't have to drive all the way to Walla Walla to get their prescription, so local in whatever town they live in. But that's up to them. So Sheba can help you to get started with Medicare or Social Security. It's best practice to start as early as your 3rd month before the month of your birth. Always document when you talk to Medicare or Social Security. And we have counseling one-on-one to help people through the Medicare process. And thank you for joining this session. And if you have any questions, my phone number is here, my direct, my desk, or the office phone number, or my email address if you have any questions.